Connie Haxby. I wanted to give some clarification for a couple of things that I find people get pretty confused about when it comes to therapy. Oftentimes I will get calls and people will ask if I am a provider for medication, ask if I do psych testing, what kind of therapies that I do, and what my credentials are. A lot of folks are under the impression that psychiatrists do therapy, that therapists provide medication, and other assumptions about mental health services. First thing that I wanted to share is that psychiatrists are medical doctors, and psychiatrists are the ones that you go to for medication, evaluation, and maintenance. Psychiatrists will tend to do about an hour session with you first for a assessment to see what's going on and what medication might be best for you. After that, they typically see you every month to 3 months for medication management, just to make sure that the medication that they have prescribed is working correctly for your needs. They typically do not do any kind of therapy, talk therapy, so typically sessions tend to be anywhere from about 10 to 20 minutes for those medication evaluations. So there shouldn't be an expectation really for psychiatrists to do any kind of therapy, which brings us to a therapist. Therapists have all kinds of credentials and titles: therapist, social worker, counselor. I am an LCSW, licensed clinical social worker. There's also licensed marriage and family therapist, LPCCs, licensed professional counselors. There's so many, and we all basically do the same thing. Now, we might have different credentials and licensures, and we might be certified in certain therapies, but pretty much the qualifications that you have to have are a master's degree or higher, and licensed in your state, which usually means a certain number of hours that you have to do to complete licensure, taking a licensure exam that you have to then keep up every 2 to 3 years. Therapists are the people like me that you're going to be seeing usually on a weekly to bi-weekly basis. We are the ones that provide typically anywhere from 45 to 90 minutes of treatment per session. That's when you're going to get into, again, assessments, and then also talking about treatment plans, what you're wanting to work on. And it's not just talk therapy that we do. We don't give advice. I think that's another assumption that people have about therapists is, I want to go to someone who's going to fix it for me and give me advice and tell me what to do. And we don't do that. We basically ask questions and guide you in such a way so that you can figure out for yourself, through self-determination, what you want to do differently, how you want to approach things differently, and go from there. Psychologists are another area of mental health that people get confused about as well. Psychologists also have higher levels of education, so master's degree or even doctorates. They are not medical doctors, however. They do not do any prescription medications either. And psychologists can do either therapy or they go through the realm of research. Something else that psychologists provide are psychological testing. So if you want to get an accurate diagnosis through psychological testing, find out about things like IQ, where you fall in verbal communication and reasoning and things like that, psychologists are who you want to see for that. Psychological testing usually takes a couple of hours at the very minimum, and that's someone that you typically have to have a referral to see. Again, some of them do provide therapy as well, but that's going to be on a case-by-case basis. You would just have to find out from that person if that's something that they do. So anyway, I hope that gives you a better clarification about what the disciplines do. Psychologists, again, briefly, are psychiatrists are medical doctors. They provide the medication, don't do any kind of talk therapy typically. Psychologists do psych testing, and some of them do therapy as well. And then social workers, LPCCs, licensed marriage and family therapists, we are the ones that do the therapy. So hopefully that gives you a better idea of what we all do and what your needs are. And hopefully I'll be posting some videos about some additional methods and modalities of treatment to give you some better ideas of things that you might be interested in when you come and visit your therapist. Until then, have a great day.